Hello, thank you for joining us. My name is Kenneth Oruka. Today, my team and I we're going to be talking to you about prioritization in patient care, and this is going to be according to the rule set forth by the National Council of State Board of Nurses. I want you to get relaxed because this is going to be information-packed presentation. In the first place, what is prioritization? It simply means deciding which needs or problem require immediate action and which one can be delayed at a later date because they are not urgent. In clinical setting, it is a process that includes envisioning clearly patient outcomes, but also includes predicting possible problems if another task is performed first.
Oh, my name is Mark. To add to what Kenneth said, prioritization includes evaluating and weighing each competing task or process using the following criteria. First, is the situation life-threatening or life-altering? If yes, this client is the highest priority. Is the situation unexpected for the disease process? If yes, then this client may be priority. Also ask yourself, is the data presented abnormal? If yes, then this client may be priority. Is the situation expected for the disease process and not life-threatening? If yes, then this client may be but probably is not priority. Is the situation and/or the data normal? If yes, this client can be seen last.
Hello, my name is Juliet. In addition to what Mark said, you are expected to base your decisions on many different bodies of information in order to arrive at a course of action. Among the basic guidelines to apply in nursing practice and in answering test questions are the nursing process and Maslow's hierarchy of needs. Maslow's hierarchy of needs is a motivational theory in psychology comprising a 5-tier model of human needs, often depicted as hierarchical levels within a pyramid. Maslow argued that survival needs must be satisfied before the individual can satisfy the higher needs.
In questions that asks which will you do first, always decide which intervention directly impacts the situation. With a question that asks which client should the nurse assess first, first look at each option and determine if the signs and symptoms the client is exhibiting are normal or expected for the disease process. If so, the nurse does not need to assess that particular client first.
The prioritization question, I want you to be sure of which patient you are looking for. Sometimes you are looking for sickest patient and sometimes the healthiest patient. For instance, if there is a fire outbreak requiring evacuation in the hospital or there is a disaster in the town requiring you to make some discharges in order to make room for incoming patient, then you should be looking for the healthiest patient, which should be the lowest priority here. But if they present a set of patients and ask you who you should assess first or attend to first, you should be looking for the highest priority patient or the sickest patient. I want you to be sure that you keep this in mind because sometimes a question might begin and midway the modifying phrase changes the entire thing, and instead of looking for the highest priority or sickest patient, you are now looking for the lowest priority patient or the healthiest patient. I don't want you to be tricked in the middle of the question. Just know that the modifying phrase is always the most important while dealing with the prioritization question. It changes the whole scenario. That's why you must be extremely careful while using the rule of ABC strategy, as we may see later in this presentation. Otherwise, you will fail.
Keep in mind, the questions will always have 4 parts: age, gender, diagnosis, and a modifying phrase. Age and gender are totally irrelevant. Ordinarily, in a pediatric question, you must pay attention to the age. However, in a prioritization question, it is not necessary because a 1-year-old is not more valuable than a 90-year-old. They are both human beings and all heads are equal.
Here are other rules. Rule number 1, ensure to attend to acute before chronic case. In other words, acutely ill person is a higher priority than a chronically ill person. For instance, if you are assigned 4 patients who came in for chronic obstructive pulmonary disease, congestive heart failure, cirrhosis, appendicitis patient status post-surgery 3 hours ago, then appendicitis patient is more acute. Don't use ABC strategy here, else you fail. Rule number 2, unstable or life-threatening cases beat stable cases. The use of such words as unstable, sudden change, new unexpected symptom, and the likes makes a patient unstable or otherwise. Do not argue. If the question says that patient is unstable, he is. Don't assume. Look out for qualifying phrase in the question.
Rule number 3, consider fresh post-operative. I mean within 12 hours before medical or other surgical conditions. For example, a patient who had abdominal surgery 2 hours ago is of higher priority compared to the one who had open heart surgery 2 days ago, or even neck dissection, bilateral BKA or ACA, craniotomy, etc. The only exception is if there is acute change in the condition of the later patients.
The key indicators from the question that will tell you that a patient is unstable includes the use of the word unstable. I don't want you to argue here. Acute illnesses, surgeries in less than 12 hours, the use of general anesthesia, critical lab of A and B value, new admission less than 24 hours, if there's a new diagnosis, if there's a sudden change in assessment data such as a spike in body temperature, and the use of the word not ready for discharge. I will remember this.
I am Christopher. How do you know that a patient is stable from question? Look out for words like unchanged, who is had, who is recovering, who is ready for discharge. Patients showing typical, expected signs and symptoms of their disease of diagnosis, etc. Also, be careful with attending to severity of symptoms. For instance, a severe pain complaint by patient diagnosed with kidney stone is expected, compared to mild pain in the eye expressed by a patient. In other words, don't look at how bad a symptom is. Look at whether it is expected or not. Moreover, do not give priority to a patient's social status. An active duty serviceman admitted yesterday, with a bullet wound requesting for pain medications, is of less priority compared to a 2-year-old who spiked a temperature of 39 degrees Celsius. Moreover, physiologic beats psychosocial needs. That is Abraham Maslow's theory of need.
Rule number 4, use tiebreaker. The more vital the organ, that is the organ of the modifying phrase, the more you should prioritize the organ in terms of organ vitality in human body. The brain is the most important organ, followed by the lungs, heart, liver, kidney, and pancreas in that order. All other organs do not agree which is more important. Let's consider this example. At the beginning of your night shift, you received report on the following patients. In order of priority, who should you see first? A 35-year-old who was brought in unconscious during the day shift. B, a 90-year-old with a past medical history of hepatitis who presented via the ambulance for evaluation of jaundice. C, a 2-year-old who was admitted for inability to void for the past 4 days. D, a 25-year-old who came in for worsening chronic obstructive pulmonary disease and is on BiPAP. E, a 60-year-old who was brought in for sudden chest pain with ECG results showing acute street elevation in inferior and lateral leads. Following the rule of organ vitality is the correct answer, as the brain is the most vital organ. No one can tell what is happening to unconscious patient until he is first properly investigated. Thus, he is the priority in this question.
Be careful, however. As mentioned earlier, they might start talking about a particular organ, and the modified phrase of the question will direct you to another more important organ where something more significant is happening. I want us to look at this example. At the beginning of your shift, you receive the report on the following patient. Arrange in order of priority how you will see them. A 45-year-old who had anterior craniotomy 3 days ago, who is awaiting neurologist review. For me, this person, even though brain is the most important organ in the body, but the surgery is 3 days ago, and this person is already recovering, awaiting neurologist review. He can wait. B, a 90-year-old with the past medical history of hepatitis, who presented via the ambulance for evaluation of jaundice. What do you know about hepatitis? Jaundice is a symptom of hepatitis. So they didn't tell us that something new is happening. Because of that, this patient can as well wait. C, a 20-year-old with a history of chronic kidney disease, who was admitted for bilateral leg swelling and has a potassium level of 6.7 and a significant ST elevation in ECG. This is concerning to me. Remember, apart from that, the fact that the heart is the third organ in terms of organ vitality, there is a critical potassium which predisposes one to heart attack. EKG is already telling us that the person is probably having a sign of heart attack. Why not see this person first? Because of this, I will place this person in the topmost list. They said a 25-year-old who came in for worsening chronic obstructive pulmonary disease and is on BiPAP. Lung is the second most important organ in the body. However, COPD is a chronic illness. This person is already on BiPAP. I think he can wait while I assess the person that is about to have a heart attack, and then I will go and see him. Because of this, I will probably place this person as next to C. Let's look at E. E said 60-year-old who was admitted for chest pain and has a history of angina pectoris. We know that chest pain is a symptom of angina pectoris. I would be most concerned if I was told that this chest pain is not relieved by Nclex-Rn or other intervention, by which I will say that this is unstable angina, which will be concerning to me. Because of these my reasons, I will say that the correct order of priority will be C, D, E, B, and A. Thank you.
Also bear in mind, when a question asks what you should do next, you should determine from the information given in the question which steps in the nursing process have been completed and then choose an option that matches the next step. Let's look at this example. A patient admitted for peptic ulcer disease has a blood pressure of 88/42, an apical pulse of 132, and respirations are 28. The nurse writes the nursing diagnosis of altered tissue perfusion related to decreased circulatory volume. Which intervention should the nurse implement first? Number 1. Notify the laboratory to draw a type and cross-match. Number 2. Assess the client's abdomen for tenderness. Number 3. Insert an 18-gauge catheter and infuse lactated ringers. Number 4. Check the client's pulse oximeter reading. The correct answer is option number 3. This intervention matches the diagnosis of altered tissue perfusion.
Note in the above example that the assessment has been completed for you. Your next action should be to address the problem of fluid deficit. Hence, the correct answer was option number 3.
Most questions will test your knowledge of nursing process, which include nursing assessment, nursing diagnosis, planning, nursing intervention, and evaluation in that order, so ensure to follow the steps where applicable. Consider the following question. You are assigned to a patient diagnosed with congestive heart failure who is currently complaining of difficulty breathing. What will you do first? A. Notify the healthcare provider immediately. B. Administer furosemide intravenous push. C. Check the client for adventitious lung sounds. D. Request the respiratory therapist to administer a treatment. The correct answer is option C. Do assessment first to guide your intervention. As a nurse, you can initiate oxygen up to 5 liters per minute without prescription. D is appropriate after your initial intervention fails. B is appropriate if assessment confirms fluid overload. Notify the provider later. Relieving patient's symptom is priority. Note, in 90% of the cases, if there is anything you can do, don't pick the option of notifying the provider, else you fail. This is an example of an assessment question. You should be on the lookout for words that indicate assessment, such as check, assess, measure, etc. However, as Kenneth would always say, be careful not to always select assessment as your answer. If option C in the above question had changed to assess urinary output, it would have been wrong, as it is not related to heart failure or breathing difficulties.
My name is Kesley. In addition, be informed that assessment is not always the correct answer when the question asks, what should be done first? Assuming that option D in the above question was to apply oxygen via nasal cannula at 2 liters per minute, in that case, assessment does not come first, as Kenneth would always remind you. Just be careful while making decision. Remember too, you may be asked to arrange in order how you will perform a task. That is also prioritization, because you have to do first thing first.
Let's see the example below. You are preparing to administer a unit of blood to a client. Which interventions should you implement? Rank in order of priority. 1. Infuse the unit of blood at 20 drops per minute the first 15 minutes. 2. Check the unit of blood and the client's blood band with another nurse. 3. Initiate wide tubing with normal saline via 18-gauge angiocatheter. 4. Assess the client's vital signs and lung sound, and assess for a rash. 5. Obtain informed consent for the unit of blood from the client. The correct order of intervention is 5, 4, 3, 2, and 1. Do not be tricked by option number 4, which sounds like a follow-up assessment. You must assess the lung and skin conditions at baseline to judge your subsequent assessment.
So, in conclusion, my friends, be sure to do a lot of content review in order for you to understand this topic and follow the rules we've stated above. However, I don't want you to assume because we said some symptoms are expected, and then you say that symptoms like hemorrhage, high fever, hypoglycemia, pulselessness, and breathlessness that is witnessed should be overlooked because they are expected symptoms. Never, and I said never. Remember too that in a scene of unwitnessed accident, pulselessness and breathlessness is the lowest priority. The reason is because you have to save other patients who have higher chances of surviving. Just a recap. A patient who is asystole and does not have a pulse is a high priority, even though it is expected that they will not have a pulse. Remember too, a patient diagnosed of nasal hemorrhagic fever or meningitis and has a temperature of 40 degrees Celsius is a higher priority, not minding that fever is expected in those diseases. Lastly, a patient who is in severe asthma exacerbation and is breathless is not only a priority because of the ABC rule, but a priority because he is breathless. I want you to take this away and don't mix issues.
Thank you for
watching.
Thank you for watching.
Thank you for watching.
Thank you for watching.
Thank you for watching. God bless you. Bye-bye.
Follow us on Facebook and YouTube for more. Also stand a chance to win huge prizes when you answer our questions correctly on our page. Come. Let's keep our brain active.